Laparoscopic surgical cases create a unique challenge when attempting to evacuate surgical smoke plume. Surgical plume obstructs the field of vision and creates a toxic gaseous mixture that may be absorbed into the patient. Studies have shown that this absorption can have negative effects on the patient during and post-operative. The LapEvac laparoscopic smoke evacuation device is the world's first closed-loop recirculating smoke evacuator specifically designed for minimally invasive surgery. The LapEvac system arrives to the facility sterile. To set up the LapEvac, remove the system from the sterile packaging. The LapEvac may be used with as little as 2 surgical cannulas, otherwise known as trocars. The process of connecting the LapEvac system is as easy as 1, 2, 3. Please note, there are a few methods of connecting your insufflation line when using LapEvac. One very common method will be demonstrated here. However, if you choose not to connect your insufflation line to the LapEvac, there is no need to remove the blue cap from the Y connector as described in Step 1. Additionally, if you choose to establish your pneumoperitoneum by connecting the insufflation line directly to a trocar for initial inflation, with the intent of connecting it to the LapEvac at a later point, the blue cap on the Y connector can remain affixed until such time. To begin, first remove the small blue cap from the Y connector on the length of tubing with a blue "To Patient" label affixed to it. The blue cap can be removed by turning it to the left and unscrewing it. It may be discarded upon removal. Connect your insufflator line to the port uncovered by the blue cap by screwing the connector to the open port until tight. Secondly, connect the remaining outlet from this "To Patient" blue labeled line to a trocar that will be positioned closest to the camera during all or the majority of the procedure. The clean filtered contents of the peritoneal cavity will be returned to the patient via this hose line. Again, this connection can be made by screwing the connector to the trocar lower lock outlet located on the side of the cannula. Finally, connect the "From Patient" red labeled line to a trocar that is positioned furthest from the camera. This line will be used to draw the surgical smoke and particulate into the LapEvac filtration device. The connections have now all been established, and you may proceed with establishing your pneumoperitoneum. The LapEvac smoke evacuator is battery operated. The batteries are protected from degradation by the blue membrane located under the battery cover. To activate the batteries, pull the blue strip in the direction of the arrow until the strip releases from beneath the battery cover. The batteries are now activated and the system is ready to use. The unit should be placed in a secure location within the sterile field. It may be placed on the table next to the patient, nestled in the drapes atop the patient, or secured to the surgical drapes using the drape clip located on the unit. Alternately, the LapEvac may be wrapped up into the surgical drape and secured with a set of surgical clamps or other similar device. Due to the fact that the unit is battery operated, there is no concern of harmful heat generation or shock. Open the ports located on the side of the trocars in which LapEvac is connected, allowing for CO2 to enter into the device. The system may now be turned on. Use the small black switch located on the top of the unit to turn the system on. The unit should be turned on at the beginning of the case or at the inception of smoke plume generation and left running throughout the procedure. The LapEvac is equipped with a battery life of approximately 3.5 hours. The LapEvac will now begin to circulate the CO2 used to create the pneumoperitoneum and is prepared to capture and filter surgical smoke plume generated interabdominally. The LapEvac system incorporates a few additional helpful features that will ensure effective operation. During periods of heavy smoke generation, such as when cauterizing or lacing fatty tissues, the system turbo purge valve may be implemented. The turbo purge valve will significantly increase the suction power of the LapEvac to manage this period of heavy smoke plume. Simply depress the turbo valve until the word "normal" no longer appears and the word "turbo" is visible on the lower portion of the valve. This system will now allow filtered, non-harmful CO2 to enter the room, aiding in keeping the surgical field clear of smoke plume. The insufflator will compensate for any CO2 loss during turbo purge activation. Once the period of heavy smoke generation subsides, Simply slide the turbo valve back to the normal position, and the LapEvac will once again operate in a closed-loop mode. Finally, the LapEvac from patient line is outfitted with a wicking agent to absorb moisture drawn from the peritoneal cavity, particularly during the use of ultrasonic devices. At the end of the case, the LapEvac may be used to help safely evacuate the CO2 gas from the peritoneum. Simply discontinue the use of the insufflator, place the LapEvac turbo valve in the turbo purge position, and turn the LapEvac system on. The LapEvac will now draw the gas from the abdomen, filter it through an ultra-low penetrating filter, and safely evacuate the peritoneum without forcing the contents back into the patient or into the operating room's breathing space. Before discarding the LapEvac at the end of the procedure, the batteries may be removed if so desired, or if required by facility protocol. Simply remove the small screw that holds the battery cover on and remove the 4 AA size batteries. The remainder of the unit may be discarded per hospital protocol for managing biohazardous waste. Thank you for choosing the LapEvac smoke evacuation system. If you have any questions or need any assistance with its operation or its accessories, please contact your Buffalo Filter representative at, toll-free in the U.S., 1-800-343-2324, outside of the U.S., 1-716-835-7000. Email smoke-info@buffalofilter.com or on the web at www.buffalofilter.com.